Hello everyone. As you all know that people always say listen to your heart, love from your heart. But we say please take care of your heart. As you know, this year 2023 World Heart Day is coming on 29 September and this year's theme is Know Your Heart. So on this occasion, we, Dr. Amruta Prabhu from Freedom from Diabetes, along with Dr. Nupur, who or the entire team of Freedom from Diabetes would like to bring to you some quick myths and some quick questions about knowing your heart. So let's begin with it. So Dr. Nupur, as you all know that when we say that there is a very popular myth, like whether you say that the heart disease is always a genetic issue, or some people say that it is because of the lifestyle disorders. What do you think? Is it genetic or only lifestyle disorder?
Yeah, so lifestyle disorder as well as genetic system has a role to play here. Now, talking about the genetic factors, we cannot really do much about it. So let us talk about the lifestyle factors. So there are many lifestyle factors which play a major role in affecting a heart disease.
Okay. So can you tell me like what are the risk factors about them?
Yeah, so there are a lot many risk factors which we can work on and modify. So starting with diabetes mellitus, hypertension, which is high blood pressure, then sedentary lifestyle, smoking, alcohol, increased fatty acids, trans fatty acids in your diet. So these are the various factors which we can modify and reduce the chances of getting heart disease.
Yeah, so now you know, as we see many patients, and many times my patients come to me and tell me like, doctor, I am now 65, my blood pressure at around 160 is okay. That is what the book says. This they start calculating as per their age, their blood pressure, and they say like around 20 to 30 points extra is okay above the target line. So is
Right.
this correct?
This was considered to be true in earlier days, but with the new guidelines that have come up, for any age, a BP of systolic BP of 140 millimeters of Hg and diastolic BP of 90 millimeters of Hg and above is considered to be hypertension. So anybody having a BP of 140, 90 and above should definitely go for modifications in their lifestyle or start with treatment depending upon the levels.
Yeah, so as you say, like modification of lifestyle, so means prevention of this heart disease.
Obviously.
So can you give our audience some pointers about prevention of heart disease? What?
Yeah, so as we discussed earlier, the modifiable factors. So if you are alcoholic, you should reduce the alcohol content. Smoking is a big no.
Yeah.
No smoking at all. Then as far as the diet is concerned, we can reduce the amount of trans fatty acids, saturated fatty acids in our diet. We should decrease the salt intake in our diet. Sugar consumption should be reduced, the refined sugars that we generally practice to have in our daily lifestyle. Along with that, weight reduction, a BMI of 25 and lesser would be considered good and would reduce the chances of having heart disease.
Okay, sure. So last but not the least, okay, now when you say that we recommend our patients, like if they want to know what they need to do exactly, how many tests they have to go through in a year, whether to understand that they are ideally at a risk of heart disease or no,
Right.
then what a couple of tests which you will recommend them?
So definitely ECG,
Yeah.
which is a screening test.
Yes, absolutely.
And then after that we can come over to 2D echocardiography, which tells us how the heart function is at rest and also guides us on the various structure of the heart. Along with that, stress test plays another role. And if person has symptoms and stress test is not very specific in that particular case, then we can go ahead with CT angiography or coronary angiography, which is a gold standard.
Okay, good. Thank you, Dr. Nupur. Thanks a
Thank
lot
you so
for your
much.
inputs.
Thank you so
Thank
much.
you.